All right. Welcome back to the Fit 40 podcast, where we simplify exercise and nutrition for busy parents 40 plus so they can improve their health and feel amazing. I'm your host, Brian Fitzsimmons, and today we have another amazing guest with us. We have a repeat guest, third time's the charm. We have Dr. Gabby Gerbino in the house. For anybody who hasn't caught the first two, she did her residency in internal medicine. She's a primary care physician and an expert when it comes to GLP-1 medications. So pretty much every time I have a question when it comes to any GLP-1 meds, I'm like, Gabby, I have a quick question for you. And she's always incredible. So I wanted to bring those conversations to the podcast. So Dr. Gerbino, Gabby, welcome to the show.
Thank you so much for having me again. Always a fun time. I always love talking about this stuff.
Yeah. And this is really what I want this podcast to be, which is just bringing experts on and just chatting like we do off camera, because I think that these conversations are so important for people to hear, and we don't need to gatekeep it. We could just be like, listen, we're going to have a conversation like professionals do, and take what you can, learn what you can, and apply it to your own situation.
Absolutely. Yeah. And we don't want it to be a scary topic or try to take that stigma out of it. And we can work together. Fitness and physicians, we can work together.
Exactly. And it's funny that we ended up doing this in this order, because the most recent podcast episode that went out today as we're filming this was with Dr. Crystal Guevara. And we talked about GLP-1 medications as well and the whole stigma around it. And I know we got on the topic of like, what is the deal with like the stigma? I understand it, but I really don't at the same time, because there's coaches that'll like say I'm GLP-1 friendly, kind of like saying you're LGBT friendly. And you're just like, wait, why do we have to put that out there? Like, you should be friendly. You should be helping people that want your help, regardless of all this other stuff.
Yeah. And it's the same stigma that's been like surrounding like bariatric surgery. Like for many years, there was this like entire stigma of like, oh, you took the easy way out and you got surgery. And like, why does that have to be a thing? Like, nobody should have to struggle with their weight and have to feel like it's like they have to hide the fact that like, oh, I'm on Ozempic, or oh, I'm on whatever GLP, or oh, I got surgery. Like, why is that like a thing? I don't know.
And I literally, right before like hopping on here, the client that I just had minutes ago, we ended with a conversation about food noise. And he's like, and I like casually mentioned food noise. And he's like, what's that? And I'm like, oh, wow. Like, a lot of people still don't know what food noise is. And it's a weird phenomenon, but like, I guess we could rehash this a little bit for anybody catching this that didn't catch part 1 or 2. But when it comes to these GLP-1 medications and exactly what they do, what are like the highlights and the things that people who would really need them for? Like, what is that criteria?
So the criteria is anybody with a BMI greater than 30, and has, if their BMI is less than 30, 25 to 27, and they have any comorbidities, they also qualify as well. But if you have a BMI of 30, you do qualify for these medications. I guess like my spiel that I usually give most of my patients is that the main thing that these medications do is they work on these GLP receptors, and the other medication, tirzepatide, works on GIP. But what they mostly do is they slow down your digestion. So they make you feel full quicker. And that feeling of fullness can kind of help, obviously, one, with losing weight. And what the studies have shown is it can help with that food noise. Those thoughts of like when you wake up in the morning and you're like, okay, what am I eating right now for breakfast? Or I need to have a snack, or I need that cupcake, or whatever it is that you're like, the food noise in your head, and basically your day-to-day is just driven by food. It helps with that. It's also been shown to decrease the risk of cardiovascular disease, so heart attack, stroke. It's also the tirzepatide study. It's also been shown to treat sleep apnea, which is a big thing too, that's correlated with obesity, bigger neck size, all of those other things. So that's kind of like the gist of it. But the biggest thing is that it slows down your digestion, but it does work on other parts of your body.
Yeah. And when it comes to having the conversation, like as I do as a trainer with clients, like the easy way that I explain it is always like there's a lot of amazing things going on, and they're starting to see even awesome applications outside of weight loss, like when it comes to drug and alcohol dependency and avenues like that. But the big thing for people right now is that due to slowing down the food motility and making digestion slower, helps you, one, eat a whole lot less, so the calories coming in are a whole lot less, and it minimizes the symptoms of things like, say, for things like high blood sugar. Like now
Yep.
your blood sugar is not spiking as much. You're not experiencing those negative side effects, which now might give you more energy to do more things and burn more calories. So now we're working
Right.
both parts of that equation and you're experiencing the benefits. Now, that being said, a lot of people that I have talked to, and I know I've had family members deal with this as well, are really struggling on the lower end of the calorie equation and experiencing bad side effects from that, to the
Mhm.
point where they're on these medications, they're feeling a little bit nauseous all the time, they're sleeping a whole lot more, they really don't have any energy to do basic life things or to exercise to keep themselves healthy and do all the things we talked about in previous episodes. So I'd love to talk about what exactly the guidelines are when it comes to
Mhm.
that, when people should potentially bring the dose down or stay where they're at, or maybe even get off completely.
Mhm. So basically, the studies that originally came out, the recommendation was every 4 weeks to up titrate the medication to the max dose. So for Ozempic, it's 0.25, then you go up to 0.5, then 1, and then 2 milligrams. And then for Tirzepatide, there's more dosages, but there's 2.55, 7.5, 10, 12, and 15. So the recommendation from the studies is every 4 weeks to up titrate the medication. That being said, for me personally, when I start patients on these medications, I see them one after the first month and usually every month subsequently after to make sure they're not experiencing any side effects. I educate them on making sure that they're drinking enough water. They need to make sure they're getting in the appropriate amount of calories per day and that they're not experiencing any side effects. If they are, that's when we have the conversation of, do we need to up titrate? Do we need to go back down? Where do we go from here? Also, are they having appropriate weight loss? So the same concepts go for weight loss as like if you weren't using the medication, 0.5 to a pound a week is appropriate amount of weight loss. Now, say they're coming to me and they're losing a ridiculous amount of weight in a quick period of time, that's when I kind of have to pull back a little bit and say, hey, you need, I don't know what happened. Sorry if I froze.
No worries, you're good.
Say if they're losing too much weight, this is when we need to pull back a little bit because quick weight loss can cause other things that can cause you to have gallstones, gallbladder issues, other side effects. So it usually comes down to a conversation with my patient, but for the most part, the recommendations are every 4 weeks to up titrate the medication to the max dose.
Yeah. And I know when it comes to that first month, at least in my experience working with people, I'm curious if there's anything in the guidelines or just general recommendations, because I know that first like week or two, especially, sometimes people just whoosh, like it
Yeah,
all
like
just kind of like falls off. And that could be water retention. It could be less carbohydrates in the system binding to water. So now they don't have
mhm.
as much weight inside of their body, or maybe due to just not having the same amount of food in their gut at one time. So do you have almost like a little bit of a wiggle room when it comes to that? Or is there like some sort of standard where it's like, let's wait for a pound average after X amount of months or anything like that?
Not really, honestly. It's just from the studies that came out as far as like how much weight loss was seen. It was 15 to 20% weight loss over, I believe it was a 12-week period of time. And that's what you look for, like healthy weight loss, but also you want to get them into like a healthy BMI and optimize their comorbidities, that sort of thing. But say they come to me after they've just started the loading dose and say they've dropped a ton of weight, sometimes I'll have the conversation say like, hey, you're doing really well in the 0.25. Maybe we don't need to up titrate this right now. You can stay on the 0.25 for another month or so and then come back to me and then we can go up to the 0.5 or whatever dosage that they're on. It's not, at least for me, I think anything in medicine is never cut or dry. And yes, there are recommendations and there are studies, but you have to look at the patient as a whole because I have a multitude of patients who are on these medications, and I can tell you that they all react differently as far as how full they feel, or if they can eat, or how much they're eating, or their nausea, or any of the side effects. Like it ranges. I have patients that have zero side effects, feel great, great weight loss, and I have patients that are on the loading dose and are so nauseous they can't eat anything throughout the day. So you have to kind of take it on a case by case basis and have an open conversation with your patient to see what's the safest and the healthiest. Like, I never want my patients to be losing an unhealthy amount of weight or get to the point where they're not eating, they're not drinking, because then you're looking at damage to the kidneys, damage to other vital organs if you're not even getting in 500 calories a day.
Yeah. Yeah, that's good to know. And I mean, for anybody listening right now who's potentially considering them or like is experiencing themselves, like I know at least from those who I've talked to who are familiar with the drug seem to be saying that, for example, tirzepatide seems to be showing a little bit less on the side effects, like when it comes to certain things like that. And then there's
Mm-hmm.
other stuff right around the corner that's going to be bigger and better, like
Right.
any drug. So we bring the side effects down, amplify the good effects, and that's kind of the pharmaceutical system at play, right?
Right. Right. Yeah. Every drug unfortunately has side effects. It's just whether you're going to get them or not. Like I said, I have patients that are on Ozempic and have side effects, and I have patients that have no side effects. I have patients that are on tirzepatide and have side effects, and I have patients that have no side effects. So it's honestly, I haven't seen a pattern, and it's been really just like a wide range. Nausea, vomiting being the most common side effect that I see.
Gotcha. Gotcha. So now let's say that somebody is, because I know, like I said, that I had a family member that prompted this whole discussion. If somebody were, because I know it's very hard to look your doctor in the eye and say, hey, I don't think this is working, especially when you've been
Mhm.
losing weight or like I feel like something's wrong because we got multiple things at play. Like things like, oh, I'm losing weight for the first time. I don't want that to stop. But I've got all these side effects. Like if you had a patient that was in that scenario, like how exactly would you like to field a question like that or a concern, or how would you like them to come to you?
Mhm. So anytime, like I said, when I start a patient on the medication, I always have them come back in a month. But I explain to them in that first visit when we start the medication, I say, hey, if you are experiencing any side effects, you cannot tolerate this, you feel like you're losing too much weight or you're not eating, whatever it is, you give me a call. And it's happened before where I have to take the patient off the medication because they're just not tolerating it. Like they're getting too nauseous, they're vomiting, all these other things. And that's my school of thought. I have had patients come to me from other practitioners who will just give them Zofran to get the nausea to go away. It depends. It's a conversation. I would rather not throw another medication at you if it's something that we can either go down on the dosage, say they're on a higher dosage and we can go down to where they were tolerating it previously, or is this really just a medication that you just don't tolerate and we need to take you off of it? And that's okay. And I have that conversation with the patient and just say, hey, I understand this may be frustrating because you want to lose weight. There are other options out there that we can discuss, but your body just doesn't tolerate it. And it has to be a risk benefit conversation and a lifestyle thing. Like personally, I don't want to be nauseous 24/7. And just giving a patient a medication to stop their nausea, it doesn't fix the problem. And it also, there are side effects from those medications that we have to worry about. So that's my personal school of thought. Like I have said, I've seen other practitioners that will use, just give patients Zofran or use like that sort of thing to help them tolerate it. But if I have a patient that's like, I'm vomiting 24/7 and I can't tolerate anything, then no, we're done. We tried it. Unfortunately, not for you. Let's talk about other options.
Yeah. And what would those other options be? Because
Mhm.
I know if I was in that situation, I'd be like, so I'm a lost cause. Like I can't get any results, even
Mhm.
though these meds were my saving grace. Like what would that conversation
Right.
transition to?
So if GLPs are not an option just because of side effect profile and things like that, there are other medications. I think we discussed it previously, but there are other weight loss medications out there that are in pill forms. They have about 5% weight loss, but they are effective as well. There's medications like phentermine, Qsymia, Contrave. These are other weight loss medications that exist in the universe that are pill forms. And then there is also surgery. There's bariatric surgery. For me, that's kind of like that last resort because it's surgery. It's a big deal. But if I have a patient who their BMI is maybe 40 or above and they really need to lose weight and they're have high blood pressure, high cholesterol, all of the things that are really bad for them long term, then that's when I sit down with them and I say, listen, this may be something where bariatric surgery would be the best option for you. And it's also too where I need to sit down with them and make sure that their nutrition is optimized, that they're at least trying to exercise. But It depends. I'm sure you've encountered this when you have patients with BMIs of 40s and 50s, they can't really exercise like you or I can, unfortunately, because they have a
Yep.
lot of stress on their knees and things like that. Obviously, you can modify exercises, but if they're short of breath, they can't even walk a couple blocks without not being able to breathe. If they have other things going on, it's difficult. So that's usually, I like I said, I look at every patient on a patient to patient basis. I never treat every patient the same. I look at them as a whole and say, like, okay, if the GLPs aren't working for you, what is going to be the best?
And to bring it back to the 5%, like that's no like small number,
Right, it's
because
right.
when we're talking clinical significance, 5 to 10% has tons of health benefits. So if somebody's looking at this from a health perspective, not just, oh, I want to look a certain way, like if we're talking overall health, that could be incredible.
Right, exactly. 5% is nothing to scoff at, but you have people that come in and you say 5% and then they're saying, well, what about the 15 and 20%, and how come I'm not getting that effect, and 5% just seems like nothing. So you have to kind of, like you said, like have that honest conversation with them and say, like, hey, yeah, 5% in the grand scheme of things may not seem like a lot, but down the line 5% can help with your blood pressure, your cholesterol, all these other things. Any weight that you can take off of your internal organs is going to be beneficial in the long run.
Exactly. And it also could be worth too for some people in that category, like exploring. Have you ever worked with somebody who is a professional when it comes to exercise or
Mhm.
nutrition? Like it is incredible to have somebody encourage you, like a medical professional or a friend or a family member, to get active, to eat better. But when it comes to the actual nitty gritty of like, how do you put a meal together? How do you get enough protein throughout the day or enough fiber
Mhm.
throughout the day? Because I know, at least from my experience, I've had plenty of people who have had conversations with their physician about possibly hopping on GLP-1s, and they were told that, hey, try lifestyle first. And then we worked on lifestyle and they're like, oh, I actually don't need it. When I eat enough protein and fiber, I have no hunger. So I
Mhm.
really have enough, I have enough trouble getting enough calories in. So it could
Right.
be worth going down that whole or down that path as well, because if you're willing to dish out, say, $500 out of pocket on Ozempic or something like that, you could find a personal trainer once a week for half or a quarter of that.
Correct. Exactly. 100%. And that's why I personally, for my patients, I will never prescribe a GLP unless they have already been on a weight loss plan, or they can show me like a food diary, or they can show me that they've been working out, or their Fitbit, whatever it is. Because again, we've talked about this before. This really shouldn't be a medication for forever unless you are a diabetic and you have all these comorbidities, whatever it is. But if we're just using it for weight loss, then you want them to make these lifelong chronic changes that they may not need the medication in the future.
Yeah. And I know that when it comes to, say, fat loss in particular, all of a sudden you might experience certain things like certain metabolic syndrome symptoms that all of a sudden go away. And now you can do more
Mhm.
things, be more active, and be able to burn more calories and be able to be in a place where you're making better decisions because your body's not as stressed from all these outside factors. It could just be that first step that gets you to the place where you need to be. And then you could take the wheels from there.
Exactly. Like if you I think we talked about this too, like with PCOS and insulin resistance. If you're on the GLP, you're able to lose weight and you basically cure your PCOS, because that's like a great way to help with your insulin resistance and PCOS and things like that. Then you fixed the problem. Like you don't need that anymore, and then you just can make those little changes as far as your diet and modifying those sort of things to like keep going long term, where you don't need the medications.
Yeah. And correct me if I'm wrong, like when it comes to that in particular, like PCOS and insulin resistance, if you double down on that and also start going in and training properly and building
Correct.
a good amount of muscle, you might not only just shut the door on PCOS or insulin
Mhm.
resistance, you might seal it and be like,
Exactly.
we don't have to deal with this again because I have this tissue in my body that will allow me to do what it needs to do in a better way because now I'm more insulin sensitive.
Exactly. 100%.
Yeah. So there's a lot of
100%.
things that can be potential or alternatives or add-ons. It's like everybody needs like this
Mhm.
mixed bag of like what exactly is their plan and their path.
Right.
And I think the big thing when it comes to these GLP-1s is that it's finally given people a lot of hope that there is a possibility that they could live this other lifestyle that they've been
Mhm.
dreaming about, but this is that first step that was never there for them.
Right, absolutely. I have patients, And for me as a physician, it's so gratifying. I have patients that come to me and they are so happy. Like they have not been happier in such a long time. Like they finally are able to lose some weight. They feel that like motivation, because like I'm sure you see this all the time. Like you go to try to start losing weight and you cut out all the calories and you're eating like nothing but lettuce and a protein shake, and you're working out 5 days a week and like the scale doesn't budge an ounce. Like, so for these patients who have struggled for so long, they start these medications, they start to lose weight, the food noise goes away. It gives so much hope, and they're so much happier, and they feel like, oh, finally I'm able to like take control of my life, and it's life changing.
Exactly. Now, in that same ballpark, there was a big question I wanted to ask, and I'm not sure, I probably have asked on the past too, but I know when it comes to things that I see people asking or people saying, like they started taking this one drug, whether it be semaglutide or whatever, and they're like, I just stopped seeing results.
Mhm.
And should I switch? Should I do this? Should I do that? And they're asking in a Facebook group, which is the worst thing to do. But like, because no one in there is actually a medical professional. But correct me if I'm wrong. My mind immediately goes to, okay, so probably two things are happening. Number one is they did lose a substantial amount of weight and there's a little bit of metabolic adaptation going on. So now their
Mhm.
basal metabolic rate is probably a little bit lower because they're holding on to less body weight, which doesn't require as many calories, number one. But number two, they're probably finding ways to get calories in because you feel better when you get calories in. So now you're consuming fat sources a little bit more. Maybe you're doing a little bit more olive oil, a little bit more nuts here and there, because that's a lot of calories for not a lot of food volume. So now they're not experiencing the benefit of these drugs where it slows down food motility because these drugs or these foods are taking up a lot of space in their gut, but now they're getting it from like fat sources, for example. It's just not doing the same thing. So I'm curious what your thoughts are on that.
So I haven't had that many patients, luckily, that have like stalled or anything like that. But for those that have, I try to look, like you said, like looking deeply into like what are they doing now? What's their diet like? Did they make any changes? Are they even eating enough throughout the day? And if they have been on the max dose of the medication for 12 weeks and they're still not losing any weight, then that's when we consider them a non-responder. And then we
But that's no
discuss
weight loss at all, right? That's not
nothing.
loss to substantial and then bang, hit a wall.
That's like no weight loss at all. But if they haven't lost any weight on that max dose, that's when we have the conversation of, okay, what are you doing? If you've optimized your diet, you're exercising, all of those things, still not losing any weight, that's when I'm going to say, like, hey, this medication isn't really working for you. We may need to take you off of it. And you can try to switch to the alternative. Usually it doesn't, again, they're just considered a non-responder to a GLP. And if they don't respond to the one, it's less likely to respond to the other. So we can switch if they really are motivated, they want to try. And then if not, we just have to take them off of it and then discuss, like I said, alternatives. Do we go to a pill, or do we try to optimize their diet and the things that they're doing, do some lab work, make sure that nothing else has come up, nothing's changed in their body, basically, like that sort of thing. I haven't had a lot of cases of that, but it does happen. Like you can be a like non-responder to these medications.
Yeah. And as you were giving that explanation, I thought of like two other things that I see a lot of on the coaching end, which is number one, like eating so few calories that you stop moving as much and you don't understand that you are because it's your non-exercise activity.
Mm-hmm.
Things like tapping your foot at your desk or like shuffling things around, or even like when you go really low calorie, you're debating if you want to sit up to go grab the remote. That's how
Right,
tired you are. And some
right.
people do get to this point on these drugs because they just cannot eat enough.
Mm-hmm.
So that's also potentially a sign that, hey, maybe it's a little too much and you need to go to the point where you back down a little bit, right?
Right. Like our bodies can't function on 500 calories a day. And I tend to have that conversation more than not with my patients as we go through. And I say to them, what are you eating? And then we realize they're only eating like 500 calories a day. And then I show them that calculator and the TDE calculator. And I tell them, like, this is what you should be eating. You need to be eating this much protein. Like, this is why you feel so terrible throughout the day, because your body has zero fuel to run off of at this point.
Yeah. And I think there is a little bit of the Dr. Now influence that is like, if you skip a meal, you're not going to starve to death. You haven't skipped a
Yeah.
meal in 20 years. And for anybody who's wondering like what TDEE is, because I know you just threw it out there and I
Yeah,
know some
sorry.
people are like, wait, what's that? So total daily energy expenditure, TDEE, and that's comprised of four things: your basal metabolic rate, your non-exercise activity thermogenesis, your thermic effect of food, and your exercise activity thermogenesis. So the four ways you burn calories, and you need to be in a sweet spot. And this is a conversation I also have this conversation many times too, where it's like you don't want to focus on how little can I eat. You want to focus on what's that sweet spot I need to be in for my body to do what it needs to do. That
Right.
sweet spot allows you to exercise consistently without feeling like you're dragging yourself there because you have no energy. That sweet spot allows you to feel that tinge of hunger without feeling like you're starving.
Right.
And that is the sweet spot you want to be in, where you can operate and do that sustainably. I'll say that again really loud: sustainably
Sustainably.
for a long time, so you can see the results you want to see rather than just trying to sprint to the finish line where you trip and fall and scrape your face.
Nobody's going to sustain weight loss when you're only eating like 500 calories a day. Like it's just nobody's going to want to live like that. Like
And
I
let's say you do like white knuckle it all the way there. You're going to have such bad effects from that. Like you're
right,
going to lose muscle. You're probably going to have some more brittler bones. You're going to
hair
potentially
loss.
lose hair, and skin and nails are going to get really like brittle. And you're going to be like, was this even worth it? Like, why couldn't we just put it off for a few more months and do it the right way, the sustainable way?
I tell all my patients this is a marathon, not a sprint. Like, you do not need to lose 20 pounds in a month. That's not necessary. Losing a half a pound to a pound a week is completely appropriate, and that's okay. That's a healthy weight loss. You eating 500 calories a day, like, one, you're probably not going to lose weight because your body's just going to hold on to like every single morsel of food that you put in your mouth. And it's like, this is all the energy I have. So you're not going to lose weight that way. And it's just not sustainable in the long run.
Yep. 100%. And for anybody who's like 20 to 50 pounds a year, really, that's so slow. That mindset and that how you're thinking about it, that's the real thing that's getting in the way right now.
Mm.
Because one of the best things anybody can do listening to this, who's like in that place right now where they're like, oh, that's so slow, go right now and look at social media and see where you're getting these expectations from. Like, where are you seeing, oh, this person lost 20 pounds in a month or whatever, and get rid of it. Get it off your timeline, because that's going to eat away at you over and over again. No matter how good you are with your diet, no matter how good you are with these medications, that's going to eat away at you and cause you to backtrack. So one of the best things that you could do coming out of this episode is just to be mindful of that. And if at any point you're like, why am I not moving that fast? Unfollow.
Mm-hmm. Yeah. This is the thing I say all the time. Like, you have to like switch the way that you're saying things. Instead of being like, oh, I only lost a half a pound. Instead of saying that, you say, oh my God, I lost a half a pound. Like, that's amazing. I haven't been able to lose a half a pound and whatever. Like, or I'm losing a pound, whatever it is. Like, you have to be mindful of those things in the way that you like the self-talk. Like, I have to do it all the time. Like, I think we've talked about this before. I have a 5-year-old daughter, and I have to constantly be mindful of the way that I'm talking about myself in front of her. Like, I said something the other day about my stomach because I had a C-section with my son, and I'm still struggling with like trying to lose that and whatever it is. And my daughter was like, what do you mean, like, you have a big stomach? Like, I have to be like mindful of those things because she's old enough now
Yeah.
to like hear those things. And I don't want her to ever feel that way. I want her to feel like, oh, I look beautiful or whatever it is. And like, you have to switch that talk instead of being like the negative talk to be like the positive. Like, yes, I lost a half a pound. That's amazing. Or yes, I lost a pound. That's whatever it is. Or even like the little victories. Like, I didn't eat that, whatever it was, cupcake, whatever it was, that maybe that's your like kryptonite. I didn't eat that today. Like, that's wonderful. That's like a win for me. Or my blood pressure is better today, or whatever it is. Like, you have to take the things that negative, those negative voices, because social media, I call it a dumpster fire, and change the negative to like the positive.
Yeah. If you don't work on social media, just get off it. Like, if I didn't have to go on social media to market my coaching, I would not be on it. Just being totally honest. But yeah, no, that what you say brings up a really important conversation, because now, like, I don't think a lot of people do take tabs like that and understand the influence it does have on their kids. Where like you say, something so innocent as that, like when we were growing up, that was nothing. Like my mom picked apart her body in front of me,
Hmm.
all the time. And I picked up on it and I'm like, should I, like, do I have that? Like, am I in this place too? Or, and then you just start these thought processes that could potentially get in the way down the road, which I'm sure everybody listening right now is probably nodding their head like, my mom did that too. Like,
Yep.
we got to stop the cycle at some point. And I think what we could do, and if anybody's listening and they're like, what do I want to get to? A good end goal would be looking at fat loss and weight loss as a side effect. Fall
Hmm.
in love with the stuff that gets you the results. Like there's a saying, once you set the goal, forget the goal, because the goal only really allows you to come up with the habits that support it and the game plan that you need to follow. Lock in on that. Okay.
Right.
When you're celebrating yourself, be like, I got 3 workouts today, or I went up 5 pounds, or I got all my protein today. And that's the stuff where it's like, now that's going to fuel everything. It's going to take a lot of the focus off of the outcome and more on the process. And anybody who caught my masterclass on the mental struggles of weight loss knows exactly what I'm talking about. This is that process. You got to get in love with it and fall in love with it, because that makes it enjoyable and sustainable.
Right. You don't want to make, I always tell my patients, like, don't make a weight loss goal. Like, I don't want the number. Make another goal. Make some other goal that's not the amount of weight that you're going to lose. Make it like, okay, you want to, whether it's you want to fit into a certain dress, or you want to feel better, feel healthier, or whatever it is. Because if you keep, I feel like this happens all the time. You keep focusing on that number rather than like how you feel or like the positive outcomes from it.
Yeah. And it, like I said, it takes away from the stuff that gets you the number. Because if you look at the number, that's like looking at the finish line at the beginning of the marathon and going, I'm not there yet. And then every single time you go to a water stand, you look back at the finish line, you're like, shit, I'm still not there yet. Instead of just saying, why don't we focus on the space between this water stand and the next one?
Exactly.
Yeah. And it also helps too to have like realistic standards and also health standards, because as you say that, it made me remember when we were on vacation. I mean, as brothers do, we just like we're giving each other shit left and right. I don't know if it's an East Coast thing, but like you don't like somebody unless you're talking shit about them, like to their
Yeah,
face, pretty much. So we're
yeah.
going back and forth, and he's like, "Yeah, lose 20 pounds, fatty." And my fiance is like, "Don't let it get to you." I'm like, "Well, it actually didn't. Like,
It didn't, yeah.
I don't care." But the reason that I don't care is because I have numbers in my head that dictate health that I'm way more focused on. Like,
Hmm.
for example, I want to get to 15% body fat because a good body fat percentage for a male is between 10 to 20%. So I want to stick myself right smack dab in the middle. And when it comes to all cause mortality risk, having a waist circumference measurement for men under 35 inches is ideal. And I'm like
Yep.
right there. So I want to try and get like just under that. And that's what I'm focused on. Not this person says I should lose 20 pounds, or, oh, I'm looking at myself in the mirror saying, I want to lose it there. I want to lose it there. It's like, no, let's pick metrics we actually can control.
Right, exactly. And the things that are going to help us live a longer, healthier life in the end. Like you're saying,
Exactly.
decrease mortality, like that's central obesity. That's a huge, huge problem. Like that's a lot of that is linked to higher mortality when it comes to heart attack, stroke, all of those things. So you're absolutely right. And that to me is a healthier, better like mindset of a goal rather than like the number on a scale.
It can make or break your whole journey. And
Hmm.
for anybody who's like super tied to the scale, try just measuring your inches. Like in
Hmm.
one time a month. That's what I do with the Fit 40 clients, because once a month is enough to see progress. And if you lose about a half an inch to an inch per month around your waist, then you can assume that, hey, I'm losing a good amount of body fat right about now. Whether your weight goes up, down, or stays the same, if you're losing inches, you're losing body fat. And typically, if we are in those populations of overweight slash obese, if your body fat is going down, your health is most likely going to improve.
Absolutely.
Yeah. That's why it made me so happy. One of my clients told me that they went to their doctor and one of the first things they did was take a waist circumference measurement. I'm like, oh, they didn't just stick you on the scale and
Needle.
that's
Yeah.
it. Wow.
I was like, maybe I have to start doing that now. Like I like don't like it. It's just like what we usually do. Like you just the MAs, or medical assistants, they like bring the patient back, they put them on the scale, they check their blood pressure, they put them in their room. But I like that. Maybe I'll have to start using that.
Such a simple standard thing where it's like, how hard is it just to loop it around somebody and be like, bang, okay, done.
Yeah. No, absolutely. It's super easy, and we could definitely do that instead of having them step on a scale.
Yeah. And
Um,
if you wanted to take it a step further, if you got like a neck measurement and and a hips measurement, like
mhm.
you could do the Navy method right then and there in the office and just be like, okay, we have an estimated amount of body fat percentage and estimated amount of lean mass versus fat mass. And let's see if this improves. Like that's basically what I do month to month with people is like,
Mhm.
see, did your body mass go up or stay the same? And did your fat mass go down or whatever? And what do we have to do? How is your consistency? And basically, I let that lean body mass dictate how long we could be in a deficit for. Because at a certain point, if you're not, like, if you are losing lean body mass at a certain rate, chances are it's probably time to take a break from the diet.
Absolutely. Yeah. But I honestly have never thought about that, never heard about I always learn something when we do these podcasts. So maybe I'm going to start implementing that into the office.
I'm glad it goes both ways because I learned so much from you that I'm like, I just wish I could return the favor.
No, absolutely. No, I learn a ton. I learn a ton.
Yeah, yeah. And just so you know, I know when I looked into it, the Navy method is about 3 to 5% margin of error. So I always tell people, I'm like, we're around
Yeah,
5 pounds down.
we're around this. Yeah, because
But I mean,
it's notorious that like I will say as like a physician, like we were not trained on a lot of this like nutrition, fitness, that sort of thing. Like I just know very minimal from what I've learned from you and obviously other like outlets,
but
um
I'd rather you know a shitload on the medication side of things. And then like because I was talking to my fiance about this, who was a co-resident with Gabby here. And when we were talking, I'm just like, you guys could learn what we do in a weekend. Like it really just comes down to like understanding things that work and like
don't
what's.
sell yourself short. It's more than a weekend, I'm sure.
I'm just saying for the most part, like when it comes to the basic stuff that helps people, but I mean, you guys went down the pharmacological route and like you understand the body to a depth that I can't even comprehend, and I know many people in my profession cannot comprehend, and that's your lane. Like so, like let's just both be in our lanes and like serve
Exactly.
people as best as we possibly can because the end result, the client, the patient, if they're getting the best of both worlds, they're going to be in such an amazing place.
Oh yeah, absolutely. Like I have always said that I will stay in my lane and I will continue to stay in my lane as a physician. And I'm sure you will see out there that there are some physicians that are opening these health and wellness centers. And like to me personally, I'm like, I don't know anything about health or wellness. Like I know the medications, I know how to optimize those things and make you the best possible medical wise, but like when it comes to like nutrition and all that stuff, like not my lane. Like I'm just going to stay in my lane. I can prescribe the medicine and then happily refer them to you for everything else.
Well, there we go. But when you say it like that, it does make sense why we like, not that it's combative, but why there's so much confusion when a nephrologist comes out with a book demonizing all sugars, or when a cardiologist comes out with a book and says everybody's got to go vegetarian. And it's like, this is probably why, because there's not like some holistic approach where it's like this is nutrition in a nutshell that you guys learn.
Right.
It's just whatever your lane dictates, and then you kind of like lock in on it, which is the reason that certain people take certain approaches.
Right. Exactly. And there's so many people with so many thoughts these days.
Yep. Yep. And they could always back it up with the science as far as like the mechanisms. But when it comes to the outcome data, for some reason, that just never surfaces. That never quite
No.
makes it into the book.
No. The only I guess like study or diet, whatever that's been like heavily studied that's shown good outcomes is the Mediterranean diet. That's
Yeah.
the one with
And
the best studies.
yeah. And you could even I know now that one of the big ones being recommended is like a combination of the Mediterranean and the DASH diet. Because
Yeah.
to be honest, 1 out of 2 people in the US with elevated or high blood sugar, or not blood sugar, blood pressure,
Blood pressure, yeah.
they could afford to go on the DASH diet.
100%. Absolutely. Yeah.
Yeah. So across the board, I don't think it's necessarily a bad recommendation.
No, no, but these people that are recommending that you eat like beef tallow, like I don't know.
Oh, well,
Can't get
if
behind it.
anybody's curious about keto or carnivore, just go, if you are on social media, follow Carnivore Cringe. As a physician, you might freak out. I'm not going to lie. I've shown Amanda some of the my fiance, some of the posts from there with like people with
Look.
cholesterol, total cholesterol at 700, and their triglycerides are like absurdly high, and they have people in their Facebook groups going, yeah, that's about right, like you seem like you're doing it the right way, and it's like, no, you're just a walking heart attack.
Exactly. I actually had a patient last week who swears by the carnivore diet. I did the patient's cholesterol levels through the roof, and
Yep.
the patient is still insisting on being on the carnivore diet, thinks it's fine.
Yep. But when you
All
have a
all
bunch
I
of people telling you that you're doing it right, this is perfect, you are supposed to be having these bowel movements that are not solid, they're just straight liquid for weeks and months on end. And if at any point you feel like crap, you're not eating enough fat.
It's crazy. It's
No,
crazy. I'm like,
it,
all I can do in these situations with those patients is just say, like, I do not recommend this. You're at whatever the risk is. We use this calculator called like the ASCVD risk calculator to show their risk of heart attack and stroke. And sometimes it's 20, 30% 10-year risk of heart attack and stroke. So I give them the risks. I say, I can't recommend this. You're at higher risk for such or such, and go from there. Like, and my philosophy will always be that I give you the information. I cannot force you to do anything, but it's unfortunate that there are people out there who are pushing this, and it could cause long-term damage.
And it does suck because it is such a powerful movement right about now. And at the end of the day, the people that are pushing this stuff are profiting off of it. They make supplements, they make books, they get money from these social media companies for having X amount of followers and monetizing it. But here you are, a hospital employee on salary with no financial incentive whatsoever to tell them to take a certain thing or not. And you're just like, yeah, I wouldn't recommend it. But here they're opting for the person that's clearly more biased.
Yeah. Story of my life, but it's okay.
Yeah.
I
And
love
just
what I
just
do.
because we got to reiterate this, because this went out of style and it became unlawful years ago, but people still think it's a thing. Do you get any kickbacks other than a Panera lunch from pharmaceutical companies?
No, I do not. I make $0 and 0 cents off the pharmaceutical companies, and the lunch isn't even that great anymore, unfortunately.
Yeah. Yeah. And I love when people are like, well, that's not true. I'm like, oh, yeah, you want to bet? My mom lost her job as a pharmaceutical rep when I was in high school because of that law. So
Hmm.
F off.
Yeah. Like, we make no money off of them at
Yeah.
all.
It's just not a thing anymore. But unfortunately, carnivore crowds, all these like wellness crowds love throwing that out there, even though they know it's outdated.
Hmm.
But it is what it is.
It is what it is.
People got to learn the right information. And that's what I'm trying to do here. Give you guys all the actual accurate info instead of just like being a talking head talking about things I think that I know because I heard some echo chamber regurgitate this crap.
Right.
Okay. Always look into it, guys. Always dig deeper. And if anything you see or hear, even on this show, on this podcast, or on social media, take it as a sign to dig deeper, not
Mhm.
take it at face value. Like learn it.
Yeah, always look up, like, sorry, that's my phone, the office phone. Always
That's
like
okay.
learn as much as you can. And if you see something that sounds a little fishy, ask your doctor, ask around. Like, it's okay. Like, don't believe everything you see on social media.
Yeah. And I do think that people who listen to this podcast are inherently a little bit better off and they actually seek out the truth rather than confirming their previous beliefs. So I think people listening right now are pretty damn smart. And I think that we're preaching to the choir because I
Right.
know my own clients, like my own people in the Facebook group, don't ask questions or topics that come up a lot, like seed oils and beef tallow and things like that. They're just like, I just want you to tell me what the deal is.
Right.
These people sound nuts. Let's keep everybody in that camp of level-headedness and just keep giving them good info.
Exactly. Exactly.
But this has been a hell of a discussion. It did not go in the direction I thought it would towards the end, but I'm glad it did. I always like reiterating this stuff because it's important for people to hear and counteract all the nonsense on the other end. But
Exactly.
I don't want to take up any more of your time. I know you're busy and have a ton of patience. So before we head out, if anybody wants to get in contact with you and if they're in Jersey and they want to see you for
Mhm.
their potential yearly or whatever, where can they find you?
So yes, I am accepting new patients. You can find me on ZocDoc, or if you have like the My Chart, but I am out of Community Medical Center. I'm like right across the street from the hospital. It's the Riverwood 1 building, and you can reach out to my office. I can give the number to you as well. I think I've given you like the information for the
Yeah.
office, but if you're one of those people that don't like to call, you can find me on ZocDoc.
And everybody who is a new listener and whoever's already been listening for a while knows, down in the show notes, down in the description, that's where you can find it. Don't feel like you need to go searching. Just go click away, find Gabby, get in there, get all the good information. And if you're not in the Jersey area, I hope that this gave you enough information where you could have some really productive and helpful conversations with your own provider. So feel free to ask them questions based on things that you heard, knowing that it came from a good place. And that way you're going to get the best care possible. All right. So thank you guys for tuning in all the way through. Thank you, Gabby, for spending another fun-filled hour with me talking all things GLP-1s. I will see you
Thanks
all.
for having me.
Of course. I'll see you guys all same time, same place next week. But until then, go kick some ass. Bye-bye.